The steady growth of e-commerce has been a source of jobs and benefits as employment in traditional stores declines. But at online retailers taken over by Walmart, workers are finding one benefit in retreat: their company-sponsored health coverage. In little more than a year, Walmart has spent nearly $4 billion acquiring e-commerce companies with thousands of workers. Last month, many learned that their potential out-of-pocket costs for medical expenses would increase in 2018 at a rate far exceeding the overall rise in healthcare costs, reaching thousands of dollars in many cases. Walmart has periodically struggled against the perception that it skimps on healthcare benefits. Facing criticism from state legislators and worker advocates that too many of its employees relied on public programs like Medicaid, a critique that a 2005 internal memo conceded had a kernel of truth, the company began expanding access to coverage and making it more affordable about a decade ago. But with costs rising in recent years, Walmart has reversed course in some ways. In 2011, it raised some premiums by more than 40%. 3 years ago, it ended coverage for employees working fewer than 30 hours per week on average. Other large retailers, such as Target and Home Depot, made similar changes. Healthcare benefits tend to be harder to come by in retail than in any other industry, with just over half of all retail employees eligible for company plans, versus more than 90% in manufacturing, according to a survey this year by the Kaiser Family Foundation. Retail workers also opt into their company plans at a far lower rate than any other industry's workers, possibly suggesting that the insurance is not very attractive or affordable even when companies do offer it. Walmart says the share of its employees eligible for company-sponsored coverage, and of those choosing it, is slightly above the industry norm. But the health benefits it offers in its online operations appear to be inferior to those of many e-commerce competitors. At Bonobos, an online menswear retailer that Walmart agreed to buy in June for $310 million, workers currently pay nothing in premiums for medical coverage in exchange for a deductible, that is, the level below which they are responsible for covering their own expenses, of $2,000 for individuals and $4,000 for families. A similar policy under Walmart's plan will cost an individual about $750 more per year in premiums and a family nearly $4,000 more, according to documents on Walmart's employee benefits website. Both plans will also feature a deductible that is 50% higher than the current one. Some of the biggest changes appear to be occurring at another recent acquisition, ModCloth, an online retailer that made its name selling hip, vintage-inspired apparel to millennial women. To keep bi-weekly premiums for ModCloth as roughly 300 workers relatively close to what they pay now, their deductibles will rise from nothing to several $1,000s per year. Some economists say that as Walmart amasses such properties, its practices could put pressure on benefits throughout the e-commerce sector, which had been a relative bright spot for low-wage workers.